Nature's Medicine's dispensary pharmacist, Laura Mentch, talks about the way she helps patients find the right medicine for them.
You have to be certified by the Department of Health. There's a 4-hour training that you have to pass the certification to be registered as a pharmacist, able to do consults for patients that get their medical marijuana card. A patient that would want to use medical marijuana needs to have a qualifying provider. It doesn't have to be their primary care physician. There are other doctors that would see a patient that would qualify them for the card, and then they also have to register for the card. It's all done on the Department of Health website. They have to have a qualifying condition, and that's where the physician comes in. That has to be verified. And once they have those two pieces done, they'll get their card in the mail. There isn't a prescription, but there is an area in the Department of Health's website where a physician can put limitations on what they would like that patient to use. So for instance, if a patient had lung cancer and the doctor didn't want them to use any inhaled products, there's an area where they can put limitations to say no inhaled products, or just notes. Maybe they'll not limit the dosage form, but they just want to put some information in there for the pharmacist to know what to kind of focus on. So we sit down, we have a consult with the patient, and I would ask you, I would know what your primary diagnosis is because I can see it in there, but then we would talk through your symptomology and what you wanted to accomplish with the medical marijuana. Is it an anxiety? Is it a sleep disturbance? Is it pain? Tourette's, seizures? Anxiety is actually a qualifying diagnosis now, as one of the newest ones. So we would talk through the symptoms that are associated with your diagnosis. I would talk to you about what dosage forms you are willing to try. They're available in a lot of different forms. When we talk about forms, it's really about how fast you want things to work or how long you want them to last. So any kind of inhaled products are going to be your fastest onset of action, but they're also not going to last as long. But for patients that have severe pain immediately in the morning, it's a good idea to have, say, your inhaled product at your bedside. Set your alarm maybe 20 minutes before you have to actually get up and get moving. You would access that medication, use it, one puff, see if it takes the edge off your pain so you can get up and get moving. If you're not someone who has a severe and acute pain and you just want something that keeps your pain
at chronic pain,
an even level during the day, we can talk about tinctures. They're drops that go under your tongue that get absorbed through the mucous membranes under there. They start working about 30 minutes, whereas the inhaled product is 5 to 10 minutes. So it really comes down to what the patient wants, how fast they want their relief, or what they can tolerate. Tincture will last longer throughout your daytime, so if you needed to use it and go to work, it would give you some relief for up to 6 to 8 hours.